Hello, I'm Dr. Russell Libby, and I welcome you to the world of medicine. As you know on this show, we cover really important and interesting topics in medicine, and we learn about these topics through the experiences of our studio audience. These are people like you and me who actually have the kinds of conditions that we all might have or loved ones might have that we need to really understand about. Today's topic is a very important one. It's on sleep. Now, we all certainly treasure that really good night's sleep. We all feel great after we've had a good rest, and we all feel like we can do just about anything. But those nights when we don't sleep well, the next day we feel pretty bad, a little confused at times, groggy, slow to get up, sometimes irritable. Well, if you have teenagers, that might happen on a pretty regular basis when you get them ready for school every morning. Why is that happening? There are a lot of people with a lot of problems that we are going to talk about. Sleep apnea, narcolepsy, a lot of terms you may hear about, may not know about, and actually you may be suffering from yourself or someone that you're living with. I really want to introduce you to one of the finest sleep specialists in the country, Dr. Helene M. Selim. She is a neurologist and she runs a sleep center in Bethesda, Maryland. And she's actually the author of quite a few articles, but actually a new book called Snooze or Lose. We'll show it to you a little bit later. Again, there we go. It talks about teens and their troubles, their difficulties with sleep and how it has impacted their education and a number of other elements in their lives. Thanks for being with us.
Thank you.
So, and I thank you all for being here too. I guess the first question I have, just to get a sense from all of you, is who really thinks they have a good night's sleep? Pretty much all the time. Well, that's a resounding response. You know, and I think it's pretty reflective of the world as it is. I mean, when you really ask someone, do you get to sleep well? Well, it's not such an easy thing to achieve. Tell me, if you had a good night's sleep, what would that be?
That's actually what led me to go get treatment for a sleep disorder, because I didn't know the answer to that question. I hadn't had a normal night's sleep my entire life.
In your entire life?
So I'm not sure, but I'm thinking maybe 9 hours of restful sleep, going to bed around 11, getting up at 7, and being ready for work in my day.
How often does that happen for you?
How often does that happen for me? Actually, now it happens quite often, but several months ago, it never happened.
So we're going to hear about why and how in a little bit. How about you?
I would agree. It's about 7 or 8 hours of good sleep, and I can pretty much define a good night's sleep by I'm totally functional about 2, 3 p.m. the next day.
Right. Do you get a good night's sleep?
I get a good night's sleep.
You do?
I do.
What qualifies for you?
7 or 8 hours.
7 or 8 hours?
Yes.
And that's a pretty consistent finding for you?
It is.
That's great.
Nobody in my house ever gets a good night's sleep, it seems, including me. One thing, I tend to stay up fairly late and have to get up early in the morning. So I tend to toss and turn, and my daughter gets to bed more, later than she really should to get up early. And my husband has sleep apnea.
Oh, boy. So you have a couple whammies there.
Yes, we do.
Worrying about a teen, thinking too much in the evenings,
right,
and then having somebody who you have to worry about and respond to through the night.
Right.
All right. How about you? Good night's sleep?
Good night's sleep for me is 7 to 9 hours, with getting up only once during the night and then waking up feeling pretty good, refreshed in the morning.
Great.
I guess for me, a good night's sleep would be probably 8 to 9 hours, and then being able to get up the next day and function totally and be ready to meet the new day.
Does that happen pretty much regularly now?
More than it used to.
More than it used to. Well, we're going to hear about what it used to be like and why and how that got better. How about yourself?
I would love to have uninterrupted sleep. I think that would be good.
Yeah. So for you, the total sleep is not as important as uninterrupted sleep.
That's correct.
So what would be a great straight piece for you?
In terms of number of hours?
Yeah.
Oh, anywhere from 6 to 8.
6
I can
to 8.
get by quite well with 6 if it's uninterrupted.
Right. That's great. And yourself?
Oh, I think that I need at least 7.5 to 8 hours.
Okay, great.
And I would feel real alert the next day with 7.5.
So you can tell?
Yes.
I think a good sleep for me is like 8 or 9 hours, but I only get about 6 or 7 with hockey.
Oh, so you're playing sports. And how about on the weekends? What's a good night's sleep then?
9 or 10.
9 or 10, all right. And probably 11 or 12 at times, huh?
I think I'd like 9 or 10 hours of sleep every day.
Every day, yeah? Okay, well, we're going to have to find out if that's feasible or even possible.
A good night's sleep for me is between 7 and 8 hours, although I
7 to
don't
8.
get that many hours of sleep. But usually on weekends I tend to.
Yeah, that's great.
I think a good night's sleep for me would be about 6 hours of uninterrupted sleep.
Yeah. And but that would equate to a larger total hours during the day. We're going to find out what that's all about too. And you?
I usually don't get that much sleep, but I guess to be comfortable, I'd like to get about 7 to 9 hours.
7 to 9 hours, that's great.
Yeah, I feel best when I get 8 hours of
8
sleep.
hours, okay. So we have a pretty good consensus, Dr. Amsalem. Everybody likes to get somewhere between, well, we have the short end at 6, but more like 7 to 9 hours. Tell us a little bit about what people need for sleep and really what it does for us.
We have a very well-educated audience about their sleep needs, for sure. We believe that most people do need 7 to 9 hours of sleep a night. And optimally, that sleep comes on a regular schedule and, as several people indicated, uninterrupted.
Right. Starting from infancy, and I'm a pediatrician, so I know I have babies coming in, they're 16 to 18 hours, but their sleep patterns change. Of course, their parents' sleep patterns really change during that period of time. But through this span of life, how does your need for sleep change? And tell us a little bit, you give us a little bit of a talk on what happens during sleep in terms of the stages and how that changes over the ages and some of the things sleep is supposed to do for us.
Sure. Well, you know, as infants, there's a lot of variability in how much sleep an infant needs. But there may be an enormous sleep requirement during infancy as a lot of growth is going on. But once we get out of infancy, children tend to need between 10 and 11 hours of sleep a night. And with the onset of puberty, teenagers actually need 9¼ hours of sleep a night. There's been a lot of data and a lot of research done, and that 9¼ hour number comes up repeatedly as in a balanced situation where you aren't short-shrifted during the school week and getting more sleep on the weekends. 9¼ hours seems to be what the physiologic need is to do all those important growth things associated with puberty. As adults, we need on average between 7 and 9 hours. There are some people who get by on a little bit less. There's some studies that suggest some people are okay on 6½. But if you're at 6 hours, I'd look at it real carefully, because a lot of times you are push me, pull you in, getting 6 sometimes and 7½ sometimes, which leaves you never quite on target. So we look at 7 to 9 hours for adults, and the sleep need doesn't really decrease as we get older. As we get into older age, over age 65 and 70, it starts to get harder to get all of our sleep in one period and at night, and more likely that one would have to nap in the afternoon, but the sleep requirement is still there. And we believe that sleep is essential. What's happening during the night, during sleep, is that we are rejuvenating ourselves from several perspectives. In deep slow wave stages 3 and 4 sleep, we're restoring ourselves physically. So we're making all the messenger RNA that we need to have all the signals flowing, to have our muscles strong during the day and be physically fit. So when you wake up and you've had your slow wave sleep disturbed, you may feel achy and tired in the morning. Rapid eye movement sleep, or REM sleep, is a fascinating stage of sleep which seems to not only restore our psyches and leave us feeling mentally clear and good, not moody and irritable and edgy. And we believe that during REM sleep we are not only clearing our thoughts, but we're learning the information from the day. And that we're major storehouses of information during the day. We're kind of multi-sensory digital cameras on auto shoot, and we're just taking all these pictures of everything, and they're not just visual, they have how we feel and what we're thinking and what we're learning at that time. We're capturing all that information, and it's during REM sleep and some in some of the other stages of sleep that we're taking all that information, consolidating it, making it into retrievable memories, so that you can pass your history test tomorrow morning and do well on it, remember what you were taught, so that you can come up with a great idea for how to solve a problem at work the next day, and so you can be a pleasant, loving partner for the person you have to live with. And so all of those things are important, so sleep restores us physically and mentally.
Well, you certainly bring up a lot of interesting points. Certainly the all-nighter doesn't work then. You're saying if you're studying listen, young students, you can't stay up all night and expect to be able to integrate that information and valuably put it into a test the next day. Make sure you time it so you get some sleep. That's always a good point. And it is amazing what the body does go through, because you can go to bed very sore and wake up really feeling much, much better. So your body does go through a lot of restorative processes. Now, it also affects, the way your digestion and the way the blood flow goes, and a lot of the purifying, I guess, that goes on in the body happens through the night that way. And you were talking about stages of sleep, and I guess that relates a little bit as to what we get for restorative or restful sleep. So we're talking about 5 or 6 hours really not being feasible, and even though there are some people who think, I only need 3 hours of sleep a night. I mean, is that real?
We don't think it's actually real. They say Winston Churchill needed very little sleep, but there are very few people, and I know that William Dement, who's sort of the godfather of sleep at Stanford, has had an open invitation for many years for anyone who thinks they only need that little sleep to come sleep in the lab for a few weeks so they can be monitored to see if that's really a constant pattern. Life is a bell-shaped curve, so I suspect there are a few people way out at that extreme, but we haven't identified them yet. So there's an open invitation from my sleep lab, too, if you want to come camp out for a few weeks if you really believe that you're an ultra-short sleeper.
So just to see if actually they get that kind of restorative sleep there. So restorative sleep, does it depend on a specific stage of sleep?
Well, there are 5 different stages to sleep, and we believe that they each subserve a different function. We are really just on the beginning of understanding these things. We know that REM sleep is involved with learning and involved with the functions that we spoke about, but the absolute specifics of exactly what happens when during the night, we don't know. We do know, in reference to the comment from one woman in the audience about wanting to be able to sleep continuously, that we need to not only cycle through the stages of sleep and spend enough time in each stage, but we need to do it in an orderly fashion, that there is something about the patterning of sleep that makes it restorative. So it's a very complex process. It's designed to be there, not to be cheated on.
Right. So, and when you talk about these stages, then they each have their own importance. It sounds like the REM or stage 5 sleep is a very important part. Do you have to go through 1, 2, 3, 4, and then get to 5? Is it one of those things where if you don't get the continuity of sleep, you won't be able to catch that part of it and you will miss on a very essential?
Well, the sleep during the night cycles through these stages, and usually if one is well rested and has been getting enough sleep, one will cycle stage 1, 2, 3, 4, 2, 3, 4, and then a 1, 2 REM cycle. So the first cycle of REM may be 90 to 120 minutes after sleep onset. But if you've been sleep restricted, we may see the first cycle of REM sleep in the first hour of the night, because your body does prioritize REM and prioritize keeping your psyche balanced. So if you've been restricting things, it's going to jump in there and get its REM when it can. To the extent that if you don't get enough sleep, you will not be able to think clearly the next day, partially because little bursts of REM or micro sleeps may be intruding into your daytime functioning. So your body prioritizes the REM sleep.
Okay, well, when we talk about, let's say, inadequate sleep, people who can't sleep, but simple insomnia, I mean, there are categories. I mean, some people have, I guess you could say, an environmental insomnia. They're sleeping next to a partner who wakes up often. Does that happen to anyone here? Have a partner who wakes them up through the night. Well, there you go. That happens to you. You say you have someone with apnea at home.
That's right.
Yeah. And you still choose to sleep in the same bed?
I do.
That's valiant, and that's wonderful. What happens there? I mean, you find that you're sleeping, and then is it movement? Is it noise?
It's both. It's both. And so I do use a white noise machine, and as you know, with sleep apnea, sometimes the person stops breathing. So I have sort of this alert, sort of a subconscious alert when I know that that's happening. So I do a lot of elbowing in the night too.
Right. So you know that there's something going on that you're going to have to respond to. And you, as you say, you have fairly interrupted sleep, and I take it it's not because you have a sleep disorder.
My husband has periodic limb movement disorder, which is like restless legs, but all parts of him can move. And so periodically throughout the night he moves. And it's not a gentle movement. It can be a very jerking. I'm amazed he's not sore the next morning sometimes.
Are you a light sleeper yourself?
I don't believe I am, no.
Oh, okay. So we have some people who have this categorical insomnia because of environmental or partner issues. What other kinds of things? Are there things that contribute to insomnia, just the simple type without some real syndrome associated with it?
You know, one of the biggest contributors to insomnia is stress and our busy lives, and a lot of people with sleep onset difficulties have those problems because they can't set aside the stressors and worries of the day and relax to go to sleep. Or when they get in bed to go to sleep is the first time they've had a moment to think about anything, and all the worries of the day come on board, and it's hard to sort them out. And then we develop a little negative feedback between our thinking and our bed, and the bed can theoretically become a place where we worry instead of relaxing and going to sleep.
When we think about sleep as well, we think about sometimes our medical problems that might contribute to our having trouble sleeping. Anyone have those kinds of issues in terms of the contribution? There are some medical conditions that people either take medicines for that could induce sleep, or that the condition itself, thyroid problems, things of that nature.
Arthritis is a huge one. I mean, if you're physically uncomfortable at night, it can be awful to go to sleep. You know, if your hip hurts every time you roll over on that side, or you have to stay on one side because the other side hurts, be very uncomfortable from the arthritides. Some of our diabetics who have to get up and check sugars or have fluctuations in their blood sugars at night can wake up from that and be uncomfortable at night. So there are a variety of problems. Fluid pills that we take for heart disease or for hypertension can cause you to have to go to the bathroom during the night and disrupt sleep.
Interesting that there are things that we do to contribute to our own problems with sleep. But I want to know a little bit more about some of these disorders. And I know that you said that you don't need that much sleep at night. And there's got to be a reason for that. We just heard we need 7 to 9 hours, and you said 6, I think.
I said 6 because I'm kind of just grateful to have 6 uninterrupted hours. For me, because I do have a sleep disorder, I have narcolepsy, it's very difficult to sleep at night, ironically. I do have, I guess, what you consider insomnia, and between the medications that I take during the day and I guess various other things. So having 6 uninterrupted hours is
very special.
Very special.
Yeah.
7, 8, 9 would be nice, but 6, you know, that would be good.
Well, I want to hear more because this is a pretty interesting difficulty, narcolepsy. And we were talking about REM sleep, and you were telling us how important that is in its restorative processes. And most of the time when you're in REM sleep, that's the time you dream.
Correct.
And it's a very special time because you basically are supposed to be pretty still while you dream.
You're actually supposed to be completely paralyzed during REM sleep and not be able to move anything except the eye movements. So REM stands for rapid eye movements. So we see eye movements, and we see movements in the tympanic membranes of the ears. But the rest of the body should be paralyzed during rapid eye movement sleep. And it's a time when we are dreaming, and not the dreams about the pile on our desk, but rather the bizarre, strange dreams. We often remember the scary ones, but if we sample people in a regular sleep environment and wake them up from REM, about 80% of REM dreams are totally pleasant.
Huh. And narcolepsy has something to do with REM sleep. I mean, you've obviously learned about it.
Actually, narcolepsy, at night when I sleep, I don't necessarily go through all of the stages. I tend to skip around if I'm actually resting. So it's kind of weird because I can actually fall asleep, and maybe within 4 or 5 minutes, if someone were to wake me up, I could start to tell you that I was dreaming about elephants or rainbows or something. And for the longest time, I didn't realize that there was anything wrong with that. And then once I was diagnosed, they said, well, but you really shouldn't be able to do that. So, usually with medication, I hope I get through all of the stages, and with the 6 hours uninterrupted, you know, I actually feel rested, but I could probably use more than that, but it's very rare that I get the 6.
All right, so narcolepsy basically is a condition for you that is described as?
It would be described as guess it's narcolepsy syndrome, where I have excessive daytime sleepiness, where during the day or at any time my body doesn't really recognize when it's actually had enough rest. And so what will happen is periodically at any time during the day I could have what they would call microsleep, or attacks of where I guess the brain is not getting the signal that I'm supposed to be alert and just naturally fall asleep.
So the daytime basically doesn't keep you alert. And it's not because you didn't sleep that well the night before. It's that your brain just sort of cuts out into a sleep state.
Exactly.
And I guess you said that you were doing this for a long time before you realized that it was abnormal.
I think it probably started around when I was about maybe 13 or 14. And I could spend all day sleeping and then all night sleeping. And again, like I said, I didn't realize that it wasn't, that it was abnormal. But with medication, I am able to stay alert during the day, and then I also take medication so that I can get restful sleep at night.
It's interesting. So at that time, when you were 13 or 14, and you thought you just were a teenager who was enjoying sleep, because all teenagers love to sleep, but for you it was every day. It wasn't just weekends catching up. Were you able to go to school?
I went to school, and I was actually, my teachers diagnosed me as being non-achiever.
Right.
I made A's and B's, so it was a situation where my parents would come to conferences and the teacher would say, well, she's making A's and B's, but she falls asleep in my class. So, and again, my doctors initially told my parents that it was just puberty, hormones, she'll get over it. And my mother did everything possible, put me in every activity to keep me out of the house so that I wouldn't be home at all I was not sleeping.
Lazy, laying around,
Exactly.
sleeping all afternoon. Right?
Exactly.
So you must be pretty bright if you were catching all this stuff on the fly in the classroom, because not being able to stay completely focused, they probably thought you had attention deficit disorder.
No, actually, they basically said that I was just an underachiever.
Underachiever, okay. I guess you did well enough so they figured you had to be at least a little attentive there. And I would imagine that also they probably thought you might have been doing drugs or something like that at some point. Anybody ever suspect that just by virtue of the fact that you were more sleepy and you weren't withdrawn, you were socially connected, you were close to the family, so they trusted you that way?
Well, no, like I said, I was active. I was in the band. I was in drums, and I was always out. I was always with my friends, and a lot of times, naturally, during, at night, I was awake and alert. So that's usually when I would do most of my studying.
I see, okay. And did you have another issue with sleeping too? I mean, at night, or was it just the medications and sleeping so much during the day that would interfere with your nighttime sleep?
When I was a teenager, not so much. Once I got into my 20s, I think it was more, I think there was more things going on, and then it started to, I think I had more of an onset then, where I would be awake from the hours of 9 p.m. to 5 a.m. and just be alert. Like that would be my noon time. Midnight would be my noon time, and it just started to progress from there. So.
Interesting. So, narcolepsy. Tell us about narcolepsy.
Well, narcolepsy is a disorder of the brain that's characterized by abnormalities of the cycling of REM sleep. And patients with narcolepsy have, we used to think, had a tetrad of 4 different symptoms, but we believe it's a pentad of 5 sets of symptoms now. There's excessive sleepiness, and our patient's complicated because she had this circadian rhythm issue of the timing of sleep superimposed on that. But in a typical patient who doesn't have 2 things going on, their sleep at night may be fragmented, so there may be a lot of micro-arousals at night, but generally it's a relatively long block of time, and waking up after 9 hours of sleep and feeling tired anyway, and being tired no matter what you do in terms of the amount of sleep you get. When we study patients with narcolepsy, we find that not only are they sleepy and fall asleep quickly during the day, so we can put someone in the lab to sleep at 10 o'clock in the morning who's had 9 hours of sleep the night before and have them fall asleep in less than a minute in the lab in a strange environment with wires on, and then cycle through REM sleep in the middle of the daytime. So that one of the second symptoms that we see in narcolepsy, we have sleepiness, some fragmentation of sleep at night, we may see what's called hypnagogic hallucinations, which she described nicely for us, which is closing your eyes to go to sleep and feeling like you're in a dream the moment you close your eyes. So the onset of REM sleep at the beginning of the night rather than cycling 90 to 120 minutes into the night. And we can see episodes of sleep paralysis where the paralysis that's normal in REM sleep may not turn off as you awaken in the morning. So patients may complain that they woke up and couldn't move and couldn't talk and couldn't yell for someone else to help them and felt trapped in their own bodies. And those experiences can last for 10 seconds or can last for 2 or 3 minutes, sometimes much, much longer. And then the last phenomenon that we see in narcolepsy is also an abnormality of rapid eye movement sleep cycling, which is cataplexy, which is the very abrupt loss of muscle resistance during the daytime. The muscles going limp, the head dropping, triggered by emotion. So taking a really good belly laugh could trigger the knees buckling or falling down, or being startled. Or I had a patient who, every time her boss buzzed and asked her to come into the office to talk to her, she'd get to almost through the threshold and feel her knees give on her because of the emotional content triggering just the paralysis of REM while you're wide awake. And cataplexy can be really distressing to patients and very impairing when it's active. And sometimes treating the sleepiness helps the cataplexy. Sometimes we need to treat the sleepiness, the cataplexy with separate medications, and the fragmentation of sleep at night. Some patients with narcolepsy complain a lot about the quality of sleep at night. Others don't have quite as much problem with it. And of course, there are variations. Some people have this more severely than others.
I'm sure. And how long was it until you were diagnosed that you were?
I was diagnosed when I was 21.
When you were 21. Mm-hmm. So that was 7 years.
Oh, wow. Thank you. Yeah. No, actually, it was 9 years ago.
Oh, that was 7 years.
Oh, I'm sorry.
I'm sort of having this same difference. I mean, I could say that too, but that's very good. That's great. So you've had that under control. I do want to hear about what you were talking about. It sounds like you've got a pretty loyal mate here who
certainly do.
Who has admitted that she doesn't sleep very well, but it's for a good reason, and you must be a pretty good guy for her to put up with that. But tell us a little bit about what has happened to you over your lifetime with your sleep issues. When you first became aware of you having a problem with sleep, did you always feel when you were young that you had pretty restful sleep?
No, I didn't have any problem when I was younger that I was aware of, anyway. I wasn't aware of this problem until about 10 years ago, I guess, something like that, 10 to 15 years ago. I have no problem falling asleep.
Right.
But once I do, I just start jerking and jumping all over the place from early on till the time I get up in the morning.
And you call it the periodic limb movement disorder. Is that what they call it?
Yes, right. The beginning of it is. And then the REM, I do not actually get into the REM stage. I have some awful dreams, which may be that stage, but I act them out. I never get to the stage of paralysis at all. I act them out. I kick, I shove, I jump, I push, I hit out. I'm just an awful mess at that point.
They're never amorous dreams?
No, seldom.
Those
seldom.
80% of good dreams don't seem to happen in our bedroom.
Yeah, I understand. Or those are the only ones that you hear about anyway. So you have two different disorders. You have one that's sort of related to restless leg, which we're going to hear a little bit about with the periodic limb movements.
Right.
And then you also have this REM sleep disorder where when you're in REM sleep, you have dreams, and instead of being paralyzed, you move in those dreams.
Yes, I am.
And that's pretty fascinating. And that just sort of came about, or you became much more aware of it or affected by it as you got to be a little bit older.
Yes, yes, definitely.
And do you feel you get adequate sleep now? I mean, has it affected the way you feel?
Yes, it does affect the way I feel. If I get my 7.5 to 8 hours, I don't know where the good sleep is, but I do feel much better with that. Short sleep, it seems to happen at 4 o'clock in the morning. And from 4 until the time I wake up is awful dreaming and the sleep REM disorder.
And I think that that's a time when we tend to get into our REM sleep more quickly and we have longer periods of it possibly or something of that nature. We cycle to it more. That's interesting. Now, what kind of insights can you give us about the REM sleep behavioral disorder? You were telling us that when people are in REM sleep and they dream, that they're paralyzed, and I guess that's a good thing.
It's a very important protective reflex. I mean, we believe that we're replaying a lot of the events of the day. If we teach someone a new sports move, then we may find during REM sleep that they're replaying the same move, that we can actually map the brain where glucose utilization is and see the same pattern of activity during the night as we learn something and then commit it to memory. And so being paralyzed during REM sleep is a very important protective reflex because during REM sleep our psyche's turned off. We're not consciously aware of the outside world. And our motor function is turned off, so your brain is all busy inside itself, which is fine and which is safe. But if the paralysis of REM sleep fails, then we have the possibility of responding to the content of dream without having our superego to say, oh no, we shouldn't do that right now. So if you're dreaming, and I think everybody can remember a really scary nightmare that they woke up from, if you're dreaming that someone's chasing you, you may jump up and start running. So I have a patient who got up, ran, flew over the coffee table, fractured her jaw, dislocated her shoulder, falling when she woke up, when she fell and hit the ground. And she was able to remember immediately just the last, very briefest piece of the dream content. So we can see often very violent activity. If you're worried that somebody is trying to attack you, you may start punching, and you're going to punch whatever's out there. We always advise bed partners in this situation, let's get the patient on a mattress on the floor, let's stay out of the way. If they wake up screaming or yelling or throwing their arms around, then walk over to the doorway, stand outside the doorway, turn on the lights, and call to them till they wake up. Because there is the potential for undirected violence. And if you go shake someone in that situation, they may think you're the guy in the dream coming after them. And it can be quite complicated to take care of this. And there are very few medications that this does respond to, but there are a few medications that seem to restore the paralysis of REM and suppress this kind of dream content. So it is a potentially treatable disorder.
Wow. And there's a stage of sleep, I guess it's a REM, a dream sleep, where you are coming out of it for whatever reason, being awoken. People tend to remember that last dream that they seem to be awoken from. And if they're desperate, people will make noises and they'll always say, I couldn't move, someone was chasing me, I couldn't move, because they became conscious. Is that in the REM evolution?
Yeah, it's very common to have sort of your psyche aroused up out of a frightening dream. So that, next time you have a frightening dream and you realize it, or if you have one that you can remember, it's often that there's something very provocative and you start to realize that you're in this situation, your psyche comes online, you're still caught in the dream and feel like you can't, and you may wake up and yell out as you wake up. And then you may remember just a moment or two of the dream. You can't remember all the chapters that led up to all this anxiety that you feel. So I think that a glimpse of that is a glimpse of what's going on during the REM sleep behavioral disorder, except we often incorporate the paralysis of REM into our fear of not being able to run or not being able to push back. Here we have the ability to do that and the potential for dangerous behavior.
Wow. You told us about something that both of you experienced, and that was, as you said, sleep apnea.
Correct.
Who discovered they had sleep apnea first?
I did.
You did. And tell us a little bit about how that evolved and when you did understand that.
I realized that I was waking up tired and sore and napping all the time and yet never getting totally refreshed. And at some point I felt like I need to find out what's going on here, because this is adding up to be a lot of sleep, and yet it's not good sleep.
Right.
So what's going on? I'd also been told occasionally that I snore.
Yeah.
So.
Well, is snoring common?
Snoring is incredibly common.
So don't feel so bad.
No.
I know I get accused of it all the time, and a couple of elbows here and there, and I can't imagine anyone doesn't. And the person who gets elbowed can always call the person who elbowed them on snoring as well. Not that you would ever snore.
I don't know. I'm not usually
awake to hear it. Right?
Yeah. So,
awake to hear it. Okay,
yeah,
so we know
but
it's ubiquitous. Everyone snores at one point or another. You just have to be in the right position. So how did it come about that that you were diagnosed with the same?
I think well, when my dad is out of town, I sometimes bunk in with my mom in their bed, and she was noticing that I breathe loudly and kind of unregular breathing.
Irregular, sure.
Yeah,
So she sort of suspected, were you having problems with sleepiness during the day? Were you having a hard time at school or things of that nature?
Yes, I would nap a few times a week and still be tired a lot and getting plenty of sleep at night, but it wasn't the good quality kind of sleep that you need to function during the day.
So, and we're going to hear a little bit about what happens to teenagers and their experience with school and the demands there upon them and what sleep can do. Or lack of sleep can do for that. But for you, you actually had a sleep problem. You were diagnosed at what age?
A year or two ago.
15.
15, yeah.
Okay. And you didn't realize you had sleep apnea until?
51.
51. Mm-hmm. So, and it could have been there for quite a while.
I feel
How about
sure
your mom,
was.
your dad?
Both of my parents had sleep apnea and would wear their CPAP machines to bed at night, and sometimes when I'd visit them, I'd joke that they both looked like space monsters because they'd kiss goodnight and put on their face masks and kind of wave across the room and go to sleep.
Well, I guess before we get into showing what that's all about, we ought to hear about what sleep apnea is specifically.
Well, sleep apnea is a disorder characterized by episodic closure of the airway. And the portion of the airway that's subject to collapsing and closing at night when we're asleep is a portion of the airway we call the pharynx. And the pharynx is behind the nose and mouth, back in behind that area, back beyond where you can see when you open your mouth and say ah. And there's a short stretch of the pharynx that's made up entirely muscles. And at night when we go to sleep, everyone who's had a young child knows when a baby's asleep, they're very floppy. And there's a drop in muscle resistance. But even as adults, we have a drop in muscle resistance when we go to sleep. That's why so many of us snore, because the airway, which in cross-section through here should look like a nice open round tube, may relax at sleep onset. If it becomes irregular, we get turbulent airflow, which causes vibration in the wall of the airway, which is snoring. And if this becomes lax enough, when we breathe in, as this is relaxed, we lose all those forces that keep it open, and the airway can actually close. And if the airway closes at night, then we're not oxygenating and doing the prime objective of breathing all night long. And the oxygenation level in the blood can drop down, the CO2 levels can rise up, and we have protective reflexes in the carotid arteries that signal the brain to say, yo brain, wake this person up, they're not breathing right. Brain signals the specific regions controlling the muscle tone, controlling the respiratory rate. We get a signal to the respiratory muscles to contract, which opens the airway back up, and a big signal to the respiratory centers to give a big pull, and somebody may give a big snort as they break open that airway and get airflow again. Every time that happens, they partially awaken. And they may not wake up enough to be aware of the problem, but the snort and the arousal may be more than enough to shake the bed and wake up the other person in the bed. So people with sleep apnea are tired and may snore loudly. Sometimes women don't snore as loudly as men do. Sometimes they sure do. And daytime tiredness and snoring are cardinal symptoms But just being inattentive, having trouble staying awake at 2 o'clock in the afternoon at work are all symptoms. And studies have shown that the bed partners have symptoms too from insufficient sleep, from the sleep interruptions, from sleep apnea. And we know that this process interferes with restorative sleep and increases the risk of heart disease, stroke, depression, and insufficient sleep makes it difficult to maintain our weight properly as well. So it wraps around into the full spectrum of it ruins all the good things that sleep can do for you.
So it actually, we were talking about all the hormonal functions and the restorative functions, and altering that whole process can really affect your metabolism. And I think there are studies that are showing that certain hormones involved in weight gain and in hunger, satiety, are sort of skewed by a lack of sleep.
Yeah, it's very counterintuitive, but you know, I always thought, gee, if I stayed up another hour, I burned up more calories, so I could just eat a little more that day. Right. And in fact, when we have insufficient sleep, our leptin metabolism at a cellular level is disturbed, and we're much more likely to not be able to maintain our weight, but to gain weight and not use those calories properly.
Sleep apnea, is it most often diagnosed by a bed partner or someone in the house or someone?
It is invariably diagnosed by a bed partner, and I think that when there isn't a bed partner, we see patients often coming in much later in the disease process. So we rely on bed partners. We rely on shows like this to alert people that this is really not just a chuckle because we're snoring, but a potentially serious disorder.
And as you say, that the incidence of stroke with hypertension, heart disease, diabetes, a whole slew of pretty significant medical conditions are going to be associated with it. When I see kids as a pediatrician, I will have kids come into the office who have either the stigmata, they look like they could be sleep disordered by virtue of their body shape and the history you get from parents who say they snore a lot. And these may be kids I'm seeing for behavioral disturbances, attention deficit disorder, things that aren't necessarily related, you'd think, to sleep, and their behavior of irritability, difficulty with their day-to-day operations. And sometimes it is due to the same sort of thing. Often with them it's big tonsils and adenoids, and certainly there's always something to think about. But we're also talking about what can happen to people when they have some alteration in that day-night cycle and the way teenagers might live their lives. You've experienced something. Have you had problems with sleep that have affected the way you can operate on a day-to-day basis?
Yeah. Sometimes when I'm trying to get to sleep, like it just doesn't come along very easily, and I get like very little sleep. Like sometimes like 5 to 3 hours. Okay, and you're now in what grade? 8th grade. So you're starting school at about what time? 7:20. 7:20. So you have to get on a bus at? 6:40. 6:40. Okay. And what time does your body tell you it's time to go to sleep usually? Well, like I can mentally tell myself that I have to get to bed like not too late after 10, but then I just can't do it, so I just end up like hanging around the house until like 1 or something. So your body says 1 o'clock's a good time to fall asleep? Pretty much. And if you try to go to bed sooner, you just lay there and look at the ceiling or wonder, what are you laying here for? I wish I could fall asleep. And then, of course, you're probably saying, are you still awake in there?
Please go to sleep. Please go to sleep. Yeah, it's been a nightmare for our family. Alex started at Robinson High School. We live in Fairfax County, and he started at Robinson High School, which is 7th through 12th. It's a very big school, and they have to transport a lot of children there in the morning. His bus leaves at about 6:40. For him to be able to wake up with getting so little sleep, he has to get up a full hour earlier and do all kinds of things just to get himself able to walk down the street in the dark and get on the bus. He can't do it alone. What it takes is me starting at about 5:50 in the morning. The whole family has to start to go on alert. The alarm went off. The alarm went off. Did you hear the alarm? Sometimes the alarm will go off for 20 minutes, and he can't rouse himself to hear it. He's so tired. And so everyone else in the household has to wake up and start to try to mobilize to drag this kid out of bed, get him down the stairs, get him dressed, get him out the door. It's been terrible for him. I mean, sleeping 3 to 5 hours so a night is what we do to people in prisoner of war camps.
Right.
You know, it's not...
To get information out of them.
Right, that's right. But this is what they're enforcing on the children here now, going to school in the dark.
Has it affected your schoolwork?
Yeah, definitely.
So you've had a hard time with school?
Mm-hmm. Like I've fallen asleep in class a lot.
Yeah. So this is a pretty significant issue, and in Fairfax County, it's something that we certainly have to deal with. There are some kids who generally will fall asleep reasonably well when they try at 10. Is that right?
Yeah, I try to.
You can, and you can fall asleep. So it's not something that everybody has to experience. And you, can you fall asleep if you try to go to sleep?
Yeah.
At a reasonable time?
Yeah.
Okay. Well, I know that what we're talking about is something that can start in childhood and sometimes doesn't end in adulthood. Tell us a little bit about what your experience with that might have been.
I'm an overgrown teenager, apparently, without a mom to wake me up. I, too, have a circadian rhythm disorder. I had the same issue when I was a teenager. It was very difficult to fall asleep. And usually until much, much later, I would fall asleep around 4 o'clock in the morning.
Wow.
And I, too, had to be up around 6 to go to school. But I was young, and I had lots of energy, so that wasn't really too much of a problem for me. At least I didn't perceive that it was a serious problem. It wasn't until I turned about 35, and suddenly that sleep was very, very necessary in order to function on a daily basis. And I also transitioned into a job where I was expected to be at work in the morning, for goodness sakes, and be on time. And that became a serious problem because I wasn't able to adapt to the sleep deprivation that I had lived with all my life. And I wasn't able to get to sleep on time, I wasn't able to wake up on time, and it became a serious problem with mood, irritability, weight gain, exhaustion. We were a real mess for a little while.
So you're a fairly spry and spirited individual, so you were lucky. You could compensate for that lack of sleep to some extent. This is called delayed sleep phase?
Syndrome, yes.
Syndrome, okay. And we have a lot of issues you could talk about from that perspective, but just give us a little overview on what it really is.
Well, a delayed sleep phase syndrome, you know, we have to think about there's what the average time that most people go to sleep is, and the time that people who work days, you know, typically people sleep between 10 and 6 or 11 and 7, and that's kind of what's considered a normal phase for your sleep. A delayed sleep phase is when one gets a normal amount of sleep, but at a later time. So the start time for sleep may be 2 o'clock in the morning, and the cycle may be 2 to 10 or 4 to noon to get the 8-hour block of sleep that one wants. So it's an alteration of the timing of the block of sleep. Not necessarily chopped up and, you know, good continuous sleep, but just not at the socially acceptable time. And what we know is that with puberty, the onset of puberty, and it gets worse as we get further into puberty as teenagers, there is a shift in the timing of sleep to later. And not only that, but that teenagers tend to operate on a little bit longer internal clock. We may all be 24.1-hour beasts crammed into a 24-hour day, but our teens may be up to 24.6-hour people trying to operate in a 24-hour day, which makes the cycle later. And what we're finding is that we're seeing more symptomatic teenagers now than we saw 20 years ago. And that seems to be related to not our basic physiology or chemistry changing, but rather the fact that we've had high school start earlier than they used to 20 years ago, and a lot more ways to stay up and perpetuate the problem. And then there are the majority of teens outgrow this. After college, they get into their early 20s and they get a job and they sync with a 7 a.m. wake-up time and an 8 o'clock work time, and things go fine. But there are night owls, and they may have their own genetic makeup. There's a higher risk genetically for people to be night owls. We find some teenagers who have a really hard time with sleep have parents who are night owls. So some of us are morning larks just in terms of those bell-shaped curves. And the night owls help us out by being evening shift workers and night shift workers. The problem comes, and it's really a syndrome, when you can't get enough sleep because your job demands that you be a day person when you're a night person.
So there are some people who really are made for certain types of jobs.
Absolutely.
Now, we have Phyllis Payne and Sandy Evans. You're here, and you were both involved extensively with this whole sleep issue with Fairfax County and their high schools. And you work with a program called SLEEP. What does that stand for?
It stands for Start Later for Excellence in Education Proposal.
Okay.
And Sandy and I started about almost 4 years ago, working to try and convince the school system to shift the high schools so that they would match the circadian rhythms that are more common for adolescents.
So the issues that we find that are really pervasive relative to the problems kids have, obviously it's falling asleep in class.
Falling asleep in class, having trouble getting to the bus. We hear from some families that have truancy problems because Fairfax County has rules about being on time.
Right.
And if you have if you have 3 unexcused absences, late 3 unexcused tardies, then that counts as an unexcused absence, 3 unexcused absences, and you fail the class. So there are actually kids and families that are dealing with truancy problems that are related to their sleep cycle. And they just literally cannot get out of bed to get to school on time.
And since we're being broadcast in Fairfax County, I think it's something that parents who are watching might want to check out. You have a website where people can find out information on
We do.
The issue.
It's called sleepinfairfax.org because we would all like to sleep in.
Okay, it's not because it's an in.
Right.
Double N.
No, just one I-N,
Right.
sleep I-N.
Yes, that's great. Okay, well, I do encourage people to check it out because it's a big issue. And there's a lot of, let's say, political debate on both sides, but it seems logical that you'd be able to accommodate what kids need, especially if you're trying to teach them how to live and how to stay well and how to learn. I'm curious, so you had this sleep phase cycle. How did you get diagnosed and what did you do about it?
I went to a sleep specialist because my general physician asked me, what is a normal night's sleep for you? And I could not answer the question. I had no idea how much sleep I needed, and really it was the mood that brought out the need to go. So I went to Dr. Mzalam, and she helped me out quite a bit. The treatment's actually quite simple.
Yeah? Well, tell us a little bit about what the treatment is.
Well, it's kind of 2 parts. The first is to make you sleepy because you don't feel sleepy in the evening, and that is taking low doses of melatonin, and that's to trigger sleepiness. Take a very low dose early in the evening, 6 to 7 hours before bedtime, and that's to make me sleepy so that I can go to bed at a normal hour. And then in the morning, I actually use a light box. It's light therapy to stimulate the neural pathway that generates the feeling of wakefulness. Mm-hmm. And so I wear a little light visor, walk around first thing in the morning, and about 20 to 30 minutes every day at the same time every day, and that's what sets my circadian rhythm to be normal rather than the physiological one that would ensue if I didn't use the treatment.
So you have to fool your brain into thinking it's daytime
right.
at the time it really wouldn't otherwise think that. And you've pretty well trained it, and you have to stay on that routine. I mean, this is like insulin for a diabetic.
Right.
If you don't, then you fall into some terrible state that you then can't correct.
Yeah, it's a very unstable equilibrium. So if I give it up for just one day, it's very easy to slip back into what would be a normal cycle for me, but very abnormal for people who go to work in the morning.
You mentioned melatonin. It's a over-the-counter medicine. It's something remarkable that it could change your life just by taking something you can buy as a nutritional supplement.
Maybe not quite that easy, but it is a naturally occurring hormone. It is involved in the cueing of the brain for when sleep is to occur. And it's been used as a hypnotic at bedtime for a very long time with very iffy efficacy. And newer studies over the last 5 years or so show that melatonin probably functions to cue the portion of the brain called the suprachiasmatic nucleus that regulates wakefulness and sleep about when to turn on and when to turn off. So in using extremely low doses, about 6 to 8 hours before bedtime, we can simulate what's called the dim light melatonin onset and tell the brain with the appearance of melatonin by taking it that now is the time to start this cycle that's going to culminate in sleep. But using melatonin alone, using the light alone, using just trying to wake up at the same time every day alone doesn't work. It is really a package that one has to buy into and really be very religious about doing in terms of putting all three of those elements together. As she said, it's very easy to fall back to the old rhythm. Her brain does not really generate those light cues on its own. She's not sensitive to light in the morning to cue it. And with our teens, we sometimes will ask them to wear sunglasses at night to try to cut down on the amount of light exposure in the evening, to try to exaggerate the light and dark signals and get the brain cued in a little more to light and dark when we want it.
So we have a lot more, let's say, influence over what happens with our sleep patterns than sometimes we allow ourselves to be aware of. We have a short period of time, but give us the 30-second, if you want to sleep well, this is the best way to set up your evenings in your bedroom. I mean, there are sleep hygiene issues.
Some general things to think about. First is to have a schedule. If you're a teen, then have a schedule. If you need a 20-minute nap after school, make it short, but do it so you can get your work done. Stay away from the caffeine in the afternoon, probably after 2 o'clock, because it'll only aggravate getting to sleep. And when you're ready to go to sleep, have a little period of time that separates your day from your night. Indulge yourself with a wind down, have a routine. Write in a diary, keep track of things, you know, sort of flush to paper is my favorite way of talking about it. Put the ideas and the things you have to think about on paper. Wind down, take a warm shower, do some yoga stretches or just some upper body exercises to let your body relax, not just your mind relax. I think MP3 players are a great transitional device. Some of our folks have said, well, we get in bed, but we can't fall asleep. Still try to stay in bed. You can't get anywhere if you're not in bed. You're definitely not going to go to sleep.
I'm trusting that this book won't do that. This is something you read during the day. So Snooze or Lose by Dr. Salem. We're going to have to end now, but I do thank you for watching. Thank you all. Until the next time, I'm Dr. Russell Libby, looking out for your health. So we sort of ran right down, right to the end there. We're going to leave this up here because it's still on camera. But you guys did great, and it was a very nice show. I think we got a lot of great information out there. You probably learned a lot about other sleep disorders you had no idea about, which is a really important thing, and that's sort of what we try to do, right?
Definitely.
That's what we try to do. There you go. There's a book right there on the screen. We'll see if anybody Googles it and tries to find it on Amazon, right?
We'll find out.
We'll find out. So that'll work great. Okay. Well, I think that probably closes us there. Nope, we're still on camera, and FPA, there it is. Okay, so what happens here, this will be uploaded to Google at some point. We do have the shows